Hi, welcome to this unique haircare initiative by IPCA. I'm Mona Sharma and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crown glory and it's a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a sign of middle-age problem when you used to lose hair or have thinning of hair or bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring even at a younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well and much of the hair loss can be avoided. Today we have with us Dr. Rashmi Sharma is a well-known dermatologist and has been practicing medicine for over many years now. She's MBBS MD specialized in dermatology, cosmetology and trichology. Currently she is practicing as consultant dermatologist at Fortis Hospital, Vasant, Kunj, and also have her own clinic, Kara Skincare, at Nelson Mandela Road, New Delhi. Dr. Sharma has dedicated her career to diagnosing and treating a wide range of skin and hair conditions while providing personalized hair care services to her patient. She takes time to listen to her patient concern and work closely with them to develop a treatment plan that meets the individual requirement. Dr. Sharma is also aware of the need for the patient and awareness and education about hair care and spend a lot of time in giving talks at various platforms across the country. Thank you so much, Doctor, for sparing your valuable time to answer quick questions on hair care for us today. Welcome to this unique hair care initiative by IPCA.
Thank you so much, Dr. Mona. Thank you for the invite. Thank you for such a warm introduction.
Dr. Amar said, uniquely बहुत shukriya. So today we are going to talk about hair care in current scenario. And whenever we talk about hair care in current scenario, the very common problem which is faced by all of us, irrespective of gender and age, is hair loss. So can you please enlighten us today, like what's normal and when to be concerned for?
See, hair loss is something when your normal hair, which is shedding, is not replaced by a new hair. That is when you call it as a hair loss. Now, hair loss can be because of variety of causes. It's very, I mean, the timing which we have here is very less to explain every cause. But considering that the when the hair loss, hair which is fallen is not replaced and it's chronically persistent, then we call it as hair loss, which is significant, and then it needs the attention of a doctor and as well as the patient who is suffering because that will only bring it to the doctor. So the normal hair fall, which we say is about 50 to 60 hair daily, is considered as normal hair fall.
Mm-hmm.
And but when the hair fall has increased chronically for more than 3 months,
Mm-hmm.
then it is serious concern.
Okay. Okay, so like when it's like too much of hair everywhere and people are complaining कि your hair is everywhere, तुम्हारे बाल हर जगह, it means you should go to the doctor at that time. Okay,
True.
very interesting, doctor. So, doctor, now that we know like what's normal and when to be concerned for, another common issue is like people who are prone to hair loss. They keep asking, "मेरे साथ ही क्यों हो रहा है?" So, what are those general causes of hair loss? Can you please enlighten us today?
See, nowadays people are going for different type of diet plans. There are somebody's going for protein rich plan, somebody's going for fat diet, somebody's going for crash diet, keto diet. So I believe that there's a lot of culprit, which is people have become too image conscious and they just want to lose weight overnight. That is not possible, but a goal to strive that you enroll yourself for certain diet plan, which is very damaging and which can be really of a huge concern. So this is one of the reason plus stress and lifestyle related. Nowadays the lifestyle is not how it used to be. People are all the time busy. Nobody you would find who is having a time for himself. Nowadays everybody is super busy. So that's another situation in which the hair fall is also progressing because you are undergoing immense stress which you do not know, which is showing up in your hair and your body is suffering and hair is nutrition is getting compromised and you are undergoing hair fall
Okay,
plus
that's
several,
great.
yeah, there's certain illness also which can trigger hair fall. So
Okay. Okay. Okay, very interesting, doctor. So, doctor, like there are many causes, illnesses, and even lifestyle stress. Everything are like are the contributor of hair loss. Then now that we know, and in this era of information, where information is everywhere, and people also like while we're traveling, we see posters and other stuff where people claim in 1,000 rupees you will get your whole hair back. So people are quite misinformed, and through this platform, can we like enlighten today? Like, what are those medical treatment options available for hair loss, like surgical, non-surgical, or any other treatment?
There are various treatment options available now. So we start with the simplest first, like in terms of oral supplementation and the scalp serum based solutions. There can be the shampoos and conditioners are also useful, and these habits, going for treatments before surgical, they are non-surgical option which is preferred, and surgical option is only preferred when the medical treatment fails. So medical treatment where you have topical medication, you have serum-based topical medication. Then you have therapeutic treatments, which is in-clinic treatment like PRP can be done, growth factor concentrate injection can be done, mesotherapy can be done. Nowadays, people are doing threads also. So lot many factors. Then supplementation of this hair, where you can take a supplement which is not only biotin or some gummies, where the ideal sequential therapy of amino acid is preferred, and several other supplementation is done, which can eventually lead to increase in the hair.
Okay, so there are like different type of treatment available, like even oral and topical, and if nothing worse, then we can go for
Nowadays, we
surgery.
also have oral supplementation like the topical preparation. We had minoxidil, so now we have oral minoxidil available. So
Okay.
oral minoxidil also works very well. So that also can be recommended to patients who are like suffering and who are not having a comfort in application. So then they
Mm-hmm.
can take something oral.
Oh, okay, interesting, doctor. So, doctor, there is one word called nutraceutical, which is getting a lot of focus nowadays. And so, can you please, with your profound experience, like, can you please enlighten us, like, what is this nutraceutical, and is there any role of this in hair health?
See, nutraceutical is getting over marketed.
Mm-hmm.
So important factor in my opinion is your lifestyle, your food, your diet. You don't need to supplement yourself day and night. You have to take a good diet.
Mm-hmm.
Nothing will replace the nutrient which you get from the food.
Mm-hmm.
Nutraceutical is just it's a supplementation of the nutrient item,
Mm-hmm.
and there's not strict regulations on that. So the
Mm-hmm.
nutraceuticals, maybe you can. There are several options available. You have a supplementation in forms of B12, D3, coenzyme Q, copper, selenium, zinc, and iron. So all these are actually important for the growth of the hair. So you
Mm-hmm.
have to understand that these are supplements which is needed. So accordingly, your body needs to be supplemented with all these nutrients
Mm-hmm.
for you to have a proper nourishment of the scalp. So everything in proportion is needed. Only protein or only fiber or only vitamin D will not do. The ideal proportion is important.
Mm-hmm. Okay, so proper nutrition through food is all important, not only
वो
depending
सबसे ज़रूरी है, दैट इज़ वो
on.
सबसे ज़रूरी है। लोगों को लगता है कि हमने सिर्फ दवाइयाँ ले ली हैं, डॉक्टर कैन आई टेक सम सप्लीमेंट एंड दैट विल नॉट replace your food requirement. Okay, there's only a formulation which help in prevention and treatment of some of the diseases in
Mm-hmm.
addition to the supplement diet which you're getting. Basically, that is what is nutraceutical. So it is a marketing term basically to enhance the product dispensing, basically, you can say.
Okay, so doctor, there are so many like herbal plant extract. Are they really helpful in managing alopecia?
See, I being an allopathic doctor, I don't really feel that it is very great. Otherwise, alopecia is something which should have gotten okay in that case. There's so many people in India follow herbal medication so blindly, but
Mm-hmm.
I don't believe in that. There can be several side effects which can be associated. So I particularly feel that you should take it with a pinch of salt. You have to get it tested that all the product which is being given is absolutely correct.
Mm-hmm. Okay, interesting. So, doctor, like you told about food and it's very important for our nutrition. So, can you please like give us some suggestion, like how do a plate should look like and those micro and macronutrients for our hair
See,
health?
I always say this, the importance of rainbow diet. If you try and include different colored food items in your plate, you will not have any deficiency. To include something which is purple, red, green, yellow, orange, blue, every color if you include in a diet, you will be not having any deficiency in any of the nutrients, micro or macro.
Mm-hmm.
So carbohydrate has to be two-third. You have to also supplement with the protein. and we have to also supplement with the vitamins and minerals.
Okay.
So everything in proportion is needed. So in the
Mhm.
plate, just try. Simple key is to follow a rainbow diet.
Okay, so doctor, you said that not to be dependent on nutraceutical, but there are on internet there are people who are claiming that taking this can help you get your hair back. So are these nutraceutical? Is it okay to buy by ourselves, or is it required to take these nutrients as per gender RD requirement or under the
I
supervision
feel
of
there
doctor?
is no strict guidelines to control
Mm-hmm.
this. So
Mm-hmm.
you all the more reasons for you to know you know you to consult a doctor before starting these supplements, and you should not start them on your own.
Mm-hmm.
What if you end up or land up in some severe serious problem because of this?
Mm. Okay. Okay. So it is always important to
Better to consult
ask.
a doctor
Mhm.
before starting anything.
Okay. Yeah. Okay. Interesting, doctor. So apart from hair loss, doctor, दूसरा very common problem is like dandruff, and it is something which is faced by all of us. So does dandruff can cause hair fall?
Dandruff can cause hair fall. Of course,
Mhm.
dandruff can cause hair fall. Just a second. कुछ और लोग फिर आ जाना, कोई बात नहीं. So dandruff can cause hair fall because that leads to telogen. So chronically infection, if it is present, that's a good thing because we can correct the dandruff problem. We can start a oral antifungal and we can start a shampoo-based treatment or a night overnight application of antifungal, which can actually help in reducing the loss of the hair. So in seborrheic dermatitis or dandruff, actually, we recommend taking the medication so that your problem can be solved, and that does lead to hair fall. That is a very common problem of hair fall, especially in winters.
Okay. So dandruff can be managed, and it can also lead to hair fall. So it is always best we do not ignore it and go to the doctor for the
Yes.
treatment. Okay. So डॉक्टर जब भी like you said about stress and lifestyle, and जब भी हम stress में होते हैं, एक घरेलू नुस्खा जो हर grandmother देती है is like oiling
Tail level.
चपला कर लो, है ना? So and they also recommend कि भर भर के लगाओ so that you get a stronger and thicker hair and your hair grow a lot. So what is the fact behind this? Oiling hair is a boon or a bad?
See, oiling hair is definitely, in my opinion, it's overrated. You can
Mm-hmm.
do oiling, but oiling will never lead to, suddenly overnight you will not gonna get increase amount of hair because of the oiling. Rather, what happens is that you end up having hair fall because of vigorous massaging leads to hair loss.
Mm-hmm.
So
Okay.
it's important to do it very in a planned way and not blindly follow everything.
Mm-hmm. Okay. 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 So now, doctor, my favorite part. Can you give us some important tips for healthy hair?
Diet, diet and lifestyle. I always
Mm-hmm.
stress upon it. Have a good balanced diet. Nothing
Mm-hmm.
happens overnight. Hair loss will also not be controlled. If you visit a doctor, also it's going to take 1 month.
Mm-hmm.
And one thing which I would recommend, which you can do, is PRP treatment. Is a really very helpful treatment. And you can go for that treatment if you are having experiencing severe hair fall, but don't sit at home and try to do things on your own and imagine, or because just because some influencer has mentioned something, don't think that that is going to solve the problem. That doesn't happen. So whenever there is hair fall, do go to a doctor, take a proper care, and supplementation really helps.
Mm-hmm. Okay.
Going to the root cause and stop stressing about hair fall that I'm having hair fall because that will lead to all the more hair fall.
Mm-hmm. Okay. Very interesting, doctor. This discussion was very informative. I'm sure our viewers have found the session very helpful. Can I take some one or two live audience questions, please, doctor?
Yeah, yeah, sure.
Yeah. So the first question from our viewer is, Doctor, do natural remedies like aloe vera or turmeric work for hair growth?
See, I don't believe in
Natural remedies like
turmeric
aloe.
and all that,
Mm-hmm.
but uh, what you can do is one thing which I like is you can start to uh, put hair oil maybe once in 2 weeks, not more than that, and
Mm-hmm.
making a घरेलू mask, which can be egg and mixed with multani mitti
Mm-hmm.
and curd,
Mm-hmm.
making a paste out of it and an application on the hair for 20 minutes and rinse it off with shampoo. And but rinsing off very religiously is important because some particle, if they are left on the scalp, can cause problem.
Mm-hmm. ओके इंटरेस्टिंग अनदर क्वेश्चन इज हाय डॉक्टर मैं भी दिल्ली से हूँ आपको अपॉइंटमेंट लेने के लिए क्या करना पड़ेगा और दूसरा मुझे एंड्रोजेनिक एलोपेशिया है मैंने बहुत कुछ ट्राई किया पर बाल वापस नहीं आ रहे हैं का कोई सोल्यूशन है मेरे लिए
Yeah, of course. You can take my appointment. It's my number is 9355217483. You can book your appointment on this number. And अगर हेयर फॉल बहुत ज्यादा है तो पहले तो वी हैव टू फाइंड आउट कि कारण क्या है, आखिर
हम्म
क्यों हो रहे हैं आपके हेयर फॉल। क्या आपको टीलोजेनिक फ्लूवियम है, क्या आपको ट्रैक्शनल एलोपेशिया है, क्या आपको पैची हेयर लॉस है, क्या आपको स्ट्रेस रिलेटेड हेयर फॉल है, कोई न्यूट्रिशन
हम्म
डेफिशिएंसी तो नहीं है। सो हम एक
हम्म
डर्मोस्कोपी से प्रॉपर स्कैल्प की एग्जामिनेशन करते हैं, ट्राइकोस्कोपी करते हैं, उसमें हमें पता चलता है कि बाल में हेयर फॉल हो क्यों रहा है। क्या आपके
हम्म
एनाजन हेयर फॉल हो रहा है या फिर टेलोजन हेयर फॉल हो रहा है। सो
हम्म
अंडरस्टैंडिंग द cycle of the hair where it is needed to reset the hair cycle,
हम्म
किस लेवल पे प्रॉब्लम है उसका पता लगा के ट्रीटमेंट करने से बहुत ही बेनिफिट होता है।
ओके Okay, very interesting, doctor. And another question from our viewers, I think every female wants to know that, डॉक्टर क्या हीट ट्रीटमेंट करने से हेयर लॉस होता है?
200% होता है, कोई डाउट मत रखो। बहुत हेयर लॉस होता है, तो हीट ट्रीटमेंट तो करनी नहीं है, केमिकल ट्रीटमेंट तो करनी नहीं है। अगर आपको कुछ भी करना भी है तो आप ब्लो ड्राई कर सकते हो। आप कोई पार्टी जानी है तो ब्लो ड्राई में एटलीस्ट वो टेम्पररी डैमेज है, वो आपके बाल को अंदर से खराब नहीं करेगा। लेकिन जब आप परमानेंटली ब्लो ड्राई करते हो, परमानेंटली आप उस पे कोई स्मूथनिंग या कुछ करते हो, तो आपके बालों के प्रोटीन को खराब करता है, वो प्रोटीन डीनेचर करता है। आप सोचो, तो अगर प्रोटीन ही चला गया, बाल क्या है, प्रोटीन ही तो है ना। अगर आपने प्रोटीन को ही डैमेज कर दिया तो बाल तो श्रिवल हो ही जाएंगे, वो लूज हो जाएंगे, वो उनकी टेंसाइल स्ट्रेंथ कम हो जाएगी, तो हेयर फॉल होगा।
Okay, okay. So female should take care of that part. And another question, even I want to know, डॉक्टर आपकी स्किन इतनी विदाउट स्पॉट कैसे है? आपका क्या स्किन रेजिमेंट है? मुझे भी ऐसी स्किन चाहिए.
So skincare is not in a day. You have to daily invest in it. So you have to start with a simple. You have to do follow very something very simple. So I'm not able to put creams and moisturizer daily. So I believe in doing skin booster treatment, जहाँ पे पूरी स्किन पे हम hyaluronic acid की इंजेक्शन करते हैं जो कि आपकी स्किन को मॉइस्चराइज करती है बेसिकली। सो मॉइस्चराइजेशन अगर हम देखा जाए तो सिंपल एक ट्रीटमेंट है जो आपको हर तरह से स्किन को हेल्प करती है, प्लस एक अच्छा फेस वॉश, सनस्क्रीन, मॉइस्चराइजर and a night serum based on retinoid is what is needed. And then you can do in-house clinic treatment like PRP for the skin, chemical peels, hydrofacial, and there's so many options which can be tailor-made. Every skin does not need the same treatment. So it basically depends upon what is your skin concern. Accordingly, हम treatment करते हैं उसके हिसाब से। और अभी क्या है कि एवरीबॉडी सब लोग एक ही चीज को फॉलो कर रहे हैं। अभी
Yeah.
सैलिसिलिक एसिड करो तो सारे लोग सैलिसिलिक एसिड करें। अभी आप ये तो देखो कि आपकी स्किन में एक्ने है या आपकी स्किन ऑलरेडी ड्राई है, फिर आप सैलिसिलिक एसिड लगा के और ड्राई क्यों कर रहे हो।
Okay, I'll quickly take one last question, and I think this question everyone wants to know. It's is asking like, what is the reason of white hair, and can white hair turn into black?
White hair turning black is very difficult. You know, you can stop the whitening, but white hair turning black is very difficult. So white hair stop you can do by, you know, there's nutritional deficiency, then that can be taken care of, and depends what age are you having white hair for. So if it is happening at the age of 30 plus, then that can happen. That's normal to have whitening of the hair. But if you're developing it at the age of 10, 15, then that is of a concern. Then you come to me, then I will fix it. But if it is happening on which age, that is important. At which age it is happening.
Okay, very interesting, doctor. So finally, doctor, would you like to give any take-home message or any other suggestion to viewers today?
See, stop learning everything online and have a good life, work-life balance, which is very important. Nowadays, what is happening? Everybody is busy. Take out time for yourself.
Hmm.
So it's important to realize it now before there is a, you know, there is a, there's a crisis. So take out time for yourself every day. Take out 1 hour as a me time and take care of your body, because ultimately you're gonna be benefited by your own body. So just be very mindful of it and have a good work-life balance. That is the mantra for a good skin.
Yes, doctor, thank you so much for sharing all your expertise with us today and answering all the
So
questions
nice
of
to
our
connect
viewers today.
with you. Thank you.
And
Have a
and
wonderful
it was
time.
delight to have you. And thank you so much for your valuable time.
Likewise. Take care, dear.
Thank you, and thank you so much, viewers, for joining us today. And let's sign off for today. And if our doctor have time, next time we can take her appointment again and create more awareness on this platform. Until then, see you, doctor, again. Bye bye.